Vanakkam, everybody. And very happy to meet our beloved Santosh Babu sir, a very transformative leader in our industry. That's what we all see him. And very good friend MVS and our Raj. So happy to share this occasion at Dravidian Professional Forum. Santosh Babu sir and MVS have covered an excellent uh, things in COVID, right? What are the future and what is going on? So what I can do, I would like to do, I will just take a step back and I will quickly walk through my personal work or my personal involvement in making the technology work for COVID for the last 1 year or so. I think the day 22nd March, the announcement came for a state national-wide lockdown. Interestingly, of course, I belong to IT industry, you all know, right? So more than the pandemic, there was an alarm, an alert came. Okay. There is very high level of pressure came arise within the IT industry. What are we going to do next? How are we going to answer our clients? Because India is a country, and especially Tamil Nadu and Chennai has a very strong IT technology. Almost more than 500,000, 700,000 employees work out of the state, and this state contributes more than 7% of our country's GDP. So, so that was like a big thing. And fortunately, I mean, part of NASCOM and work with all the CXOs. We reached out to the government IT secretary, and they're trying to figure out what next. And fortunately, we got to think, okay, we need at least the business as usual. The data center should run. The business as usual should run. So what could? Okay, then we reached out to the city commissioner of police, the then commissioner, and we said that, sir, this is what we need. And it was an hour meeting. Fortunately, all the officers were available, and immediately they said, okay, we'll create a special pass system for the IT and ITES organization to enable this, along with a few ancillary other companies, some doctors, hospitals, banks. So slowly, everybody were being part of the ecosystem to create a special pass. So that is the first level. From the approval, within 48 hours, we were able to build a platform to provide a QR scanned pass for Greater Chennai companies, public, those who are in emergency, before even our e-pass system got announced. So that is the first level of technology impact that the industry came forward and built. I think a company called Think built that along with the help of the police department. And the next came was that the biggest part was COVID contact tracing. Fortunately, I got an opportunity to be part of the COVID contact tracing, and some like-minded CXOs from Caterpillar, PayPal, and few other folks joined together. We set up a war room in our DGP office. We set up about 100 police people, started extracting data from all the database from the immigration, who traveled for some functions, events, PDS system, and health portal. We gathered almost like 2 crore people data, and we started looking at the contact tracing. And probably you all can understand, we don't even know what is contact tracing at that point in time. In the sense, by use case, we have never experienced. So we started doing. Quickly, we took help from IIT to do a CDR research, and we started pulling every day evening reports will be handed over to the DGP and health secretary and so on and so forth. By then, we were able to save considerable amount of people without spreading COVID. Again, this is a very high impact work by using an AI engine. We used it, and in fact, this got a best practice award by the government of Tamil Nadu. And then we found the migrant workers. Almost 350,000 migrant workers were scattered across Tamil Nadu. We immediately, again, another officer was in charge. So he reached out, and immediately we created a platform and segregated all the 1,782 centers across Tamil Nadu, captured the GPS location, and started identifying that, hey, these are all the people at this location. They are safe. They had food. Their health condition is good. So we started creating a dashboard. And the fourth and final thing that we have done as GPT is government and police personnel tracking system. Basically, the frontline workers, government staffs, police people, government health workers, they got affected, their family got affected, and we should give a special care, right? So the platform was built, and even at that point in time, we integrated all the hospitals of Tamil Nadu, created a severity in terms of the patient, whether they are in the COVID, whether they are at home or they are at home quarantine or they are severity in the hospital. So all these things, I think, without even knowing what to do, our state, our city, our people had the heart and courage and will and wish to support when the pandemic situation arose. And today, I should congratulate our Honorable Chief Minister, because less than a month, I think all of us will agree with me, the kind of transformation, the kind of quickness quick response that has come to the people of Tamil Nadu is fantastic and phenomenal. Within last few days, we were able to see the transformation simply superb. I think the rapid action has been enabled all of us so that we can very well witness a drastic change, especially with patient care or availability of medicines or organizing a lot of medical related, everything has been coming into a good space. I think the digital adoption that has taken a quantum leap, both the organizational level, industry level, public level, and the patient level, the usage of technology has skyrocketed in this pandemic. I think we all should agree for that. And this COVID crisis has touched every individual in different aspects, right from the basic amenities, every household, be it banking or public sector or multinational companies, everywhere have come across this space, and we all got so used to and we got convinced that hey, this is how the other phase of life is heading towards. And initially, actually, to talk about pandemic and managing the virus, a technology-driven platform helped every country to track the cases extensively through geofencing. In fact, we wanted to create, we created an application called Arogya Tamilagam, and the government approved, and we wanted to launch. By then, Arogya Setu was being mandated, so we did not move forward. As Santosh Babu sir said, getting an approval from a Google Play Store or an iOS store was so difficult because we were able to wait for, we were asked to wait for about more than a month to get an app approval. And e-consultation. I should definitely say that the prediction spread, the contact tracing, exposing the fake news. Okay, we set up a social media cell, analysis cell, basically because a lot of people are spreading fake news. That got a big alert. That got a pandemic situation. In this pandemic, people got really scary. We were monitoring that kind of people and trying to see how best we could manage the situation. In fact, we introduced quadcopter. I think, if I'm not wrong, one of the company, Qualcomm or company sponsored from the CSR funds, we started very, very high-end quadcopter we got, and we started monitoring people, started spreading the message, the safety message. And one important thing, because I come about a decade I spent with EduTech companies, so I must touch upon this. Today, when the Digital India initiative started 3 years back, no one was willing to talk about the digital education. Right today, more than a blended education, the online education has become part and parcel of everybody. E-learning portals started offering free courses, and today, completely change in the system, especially in the edutech space. For example, even temples, churches, mosques started having an online worshipping and other thing, which is like really a wow factor that people are able to adapt these things. And 3D printing that helped us to design the face shield in the very beginning of the pandemic time, because initially the health workers and the frontline people was not sure that what to wear. So this 3D printing helped them to design the the face shield that was designed out of the technology 3D. And other important example I would quote is, I think Madurai city, if I'm not wrong, I think Premanand Sinha sir has introduced AI technology to track the mask violators. Almost 80 lakhs of fine has been collected, but not to worry about the fine, but the Madurai city police, and I think Telangana also implemented that particular technology to track whether people are using masks. I think one more thing, Atmoney is another merchant platform for UPI, where 1/3 of the Indian households are using the form of digital payment. And the advantage of digital payments were better realized during COVID pandemic to avoid contacts with anybody. That is something, a very, very good growth for the country, I would say. And other important point I would like to mention is the Center for AI, DRDO, the Defense Research Development Organization, have announced Atman AI, where basically an intelligent web-based software to detect just by using an X-ray whether the person is actually having a COVID or is an pneumonia patient. So that was something, and the accuracy was fantastic, 96.73% of accuracy by using the digital chest X-rays. And I remember I'm part of the IIT and IIM group. So IIT Kharagpur launched a COVID app, where a diagnostic tech to detect infectious diseases like COVID. And according to media resources, I remember COVID app consists of pre-programmable control unit, where the special detection or genomic analysis was done at the time of test findings. So all these things are really very, very brilliant move from the country standpoint. And one such example I would like to end up and then share my other perspective is like WhatsApp-based Interbot provide users with evolving the verified database of beds, oxygen cylinders, plasma donors, And most of the medical leads were on request where this WhatsApp-based intro bot helped us. And in fact, today, even after our honorable CM's government has taken charge, on a war footing basis, things are moving. The Stop Corona TN government, the updation of beds. I was able to witness the kind of suffering initially the people had in the first couple of months, probably after the month of end of March and April. But today, I was able to see that definitely people are confident if somebody is not okay, somebody is getting into a serious stage, people are confident, they know whom to contact for what. They know that which hospital has a bed. Where are the oxygen beds? I think the clarity is slowly coming up, and I should definitely accept that part. And technology has revolutionized the conventional method of vaccine production using mRNA technology, where basically this is something very exciting, right? A vaccine making technology has been converted mRNA just by where in case of mass production of vaccines within a short period of time, this mRNA technology utilizes a DNA sequence that are synthesized electronically. So this is something a fantastic initiative. And in align to that, one thing I just wanted to again quote. I saw in the news that there was a factory near Chengalpet which is capable of manufacturing vaccines. I think immediately the chief minister went and saw that and opened it. I think this is the transformation this country, the state is expecting. 3 points I would like to mention before I put a pause. One thing is a centralized epidemic command center should be established in the state. Irrespective, see, this pandemic has taught us enormous lessons that will be considered for next 5 generations or 10 generations. I don't know. I think we should have a proper, how we have a state disaster management system. We should have an epidemic, control epidemic. It should be centralized. Centralized in the sense it should be connected to the neighboring states. It should also have a connection to the central repository. I think this is something a request I would like to place at this DPF forum. And the second important thing is a lot of people have contributed so much of things for the people who are suffering in COVID, either in a form of a donation, in a form of a food, in a form of a donation to government, a lot of such things. But today there is no standard platform for somebody to reach out, hey, I need 100 packets of food. They need to put a WhatsApp message, they need to ask somebody. So if there could be an integrated, one common platform where all the NGOs, where all the donors are authenticated, a single platform, that will be helpful for the state, not only for pandemic, but also for all the disaster and other things. And one third important thing I would like to quote, I think Massachusetts doctors at some point in time, they created a living facilities getting help from Emerald, where a device that use electromagnetic waves and AI to monitor the patients remotely. Because of the COVID spread, the frontline workers get affected, right? So from one corner of the room and one side of the wall, even if there is a wall, the Emerald can track the patient's heartbeat, the mobility and the breathing thing. Everything can be tracked so that the frontline workers are also protected. I think these 3 things really strike me that these 3 things should be next level of action for the government of Tamil Nadu for us. And one thing I will finish, and I'll tell and finish it. Twitter has played an enormous role, anonymously converted as a 24/7 SOS helpline. I should accept it because Twitter message helped a lot of people. But okay, this impacted only urban folks, I understand. But definitely I should say that Twitter has done a fantastic work, and mobile service providers like Airtel, Vodafone, BSNL started giving a voice message to all the people in terms of safety and security measures. I mean, that is also another appreciative thing I would say. And I think the technology plays a very, very vital role, and still we are at a very nascent stage because there is no end for. We used to say technology is always an enabler. I think that truly enables how to come out of this pandemic situation in the state of Tamil Nadu. Thanks for the opportunity. I'll pause here. I'll look forward to hear from the rest of my panelists. Thank you.